So for the next drug which we'll get to look at, it's pharmacology. It's a drug known as adalimumab. Adalimumab. Okay, so you can see this is adalimumab, and it goes by a very popular brand name known as Humira. Okay, so let's talk about this drug and talk about the importance and basically applications of this drug. So you should know that it goes by a brand name known as Humira. So it's a human monoclonal antibody, and in summary, it inhibits tumor necrosis factor. Okay, so it makes it very important when you are treating conditions that have to do with autoimmune issues, that's your immune system fighting itself, and inflammatory issues. Okay, inflammation in mostly joints, your intestines. Okay, that's why you can see psoriasis here, you can see Crohn's disease, you can see rheumatoid arthritis. So let's look at it properly now. Its mechanism of action is to target the tissue necrosis factor alpha, both the soluble and the membrane bound forms. So it will now prevent this tissue necrosis alpha from binding to receptors like tissue necrosis factor receptor 1 and the receptor 2. So this will now suppress, you have something in the body, but this thing is not able to bind where it can activate. So you are suppressing its function. So tissue necrosis factor normally should cause all those inflammation in the body, should encourage autoimmune disease attacks. So if you are stopping its action, you are dropping all those things. So in clinical impact now, it will now reduce all those inflammation in the joints, it will reduce inflammation in the bowels, it will reduce what? Inflammation in the skin. Alright, so we have another one which is known as Exemptia, still the same thing. So pharmacokinetics is given subcutaneous. Okay, absorption, we have the peak serum levels reaching about 131 hours. Volume of distribution is about 5 to 6 liters. Metabolism is proteolytic. It will be broken down into peptides and also amino acids. So elimination of life is about 2 weeks. So it allows you to kind of like dose it, every week. Sorry. Okay. Elimination of like 2 weeks. You can give it weekly or in 2 weeks. So it's used for treating conditions like rheumatoid arthritis. It will reduce the pain, the swelling. It will halt the damage. Inflammatory bowel disease like Crohn's, ulcerative colitis, psoriasis and also psoriatic arthritis. Other ones like Ankylosing spondylitis, Hidradenitis, suppurativa, uveitis. All those inflammatory conditions in the body can always use adalimumab to handle them.